We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Hey guys, I want to welcome you guys to the Financial Freedom for Physicians podcast. We've got a great episode this week. Before we begin, please hit the subscribe button as well as the notifications bell, and be sure to like, comment, and share if you like this episode. And we'll get into this week's sponsor and show. This week's episode is sponsored by CityVest. CityVest has quickly become the most popular and best way for doctors to invest in top-performing real estate private equity funds that are usually reserved for institutional investors. This unique access to investing in these institutional funds is available for the first time ever through CityVest's easy and secure online investment platform. CityVest does the hard work of conducting due diligence and vetting the investments. They even get a third-party due diligence report that is posted on their website. As a result of aggregating a several $million investment amount into their access funds, CityVest gains access to investing in the institutional investment and is able to negotiate better investment terms such as a 12% preferred return. You can check them out at cityvest.com or go to the link in the show notes below. Now on to the show. Before we begin today's content, here is a quick disclaimer. The information and material presented here is for informational purposes only and should not be construed as investment advice. The content is not a recommendation to buy or to sell. Some of the content may be for accredited investors only or may be sponsored posts. Every investment carries risks. Results have not been verified. So carefully weigh those risks against your investment goals and objectives and see if acting on the information matches with your investment thesis. Do your due diligence prior to investing, and as always, do not invest more than you can afford to lose. So welcome everybody to this week's podcast episode for the Financial Freedom for Physicians podcast. And I'm your host, Dr. Christopher Liu. And as you know, I tout 4 types of freedom: financial, time, location, and emotional freedom. And my mission is to bring you the up-to-date information and education from people from all over the world doing cutting-edge things and offering creative solutions to today's problems, particularly in the financial space. So today we have a physician, Dr. Heather Signorelli, and she is the founder and CEO of National Revenue Consulting, and she's going to talk to us all about medical billing and coding and all of the business solution that she offers. So I'll let her introduce herself and go from there. So Heather, welcome.
Thank you so much. I appreciate the opportunity to come and chat with you guys. So like you said, I'm a physician. I'm actually a pathologist in my day job and work for a big healthcare company and do the administration side of things. And so I do that in my day job. And then on the other side of the world, we're also running this medical billing company, which my husband runs the day-to-day operations. And it's been a lot of fun really getting in there and helping practices and helping physicians increase their revenue and get the revenue that they deserve.
Yeah. I know when we talk about medical billing and coding, consulting, a lot of physicians, their eyes glaze over. But the problem is they don't understand this space, and that's why insurance companies take advantage of them and they essentially rip them off. So I'm really fascinated to bring you on and talk to you. So tell us, just give us a general overview and lay of the land.
Yeah. And it's pretty interesting. Like you said, there's a lot of physicians who either don't have the time or the interest to get into the details. And it's certainly not necessary for a practice or a physician to know everything that they need to know in regards to billing or coding, but having the general knowledge and then having a team of people who can help support that is critical. $125 billion is lost every year in revenue because of insurance denials and the complexities around the insurance process. And again, that's revenue that is due to the physician, but is lost, again, just due to the process. And so our company, we are just a year old, and our big premise is working with physicians to help guide them in the development of their metrics so that they can understand how they're doing, create benchmarks so that they constantly know a pulse on their revenue in their company. And I think, having met with the clients we've worked with so far, the number one thing where I've seen physicians or practices lose is not having a pulse on that and hoping and praying that it's all going well. And then 6 months later, looking back going, shoot, this doesn't look like how I expected. I'm not getting the revenue I expected. What do I do now? And then they start looking for a new medical billing company, or they start looking for a new solution. And so our solution, the team that we have built really goes and works with the practice to make sure that they have the data analytics from day one. And we're constantly meeting with them on a monthly or even sometimes weekly, depending on if we're onboarding somebody, so that they know, okay, how are we doing? Are there processes we need to improve on? Are there things that we can do in the registration process or when the patient comes into the office for the first time to help simplify and streamline the billing process, right? So if you know that you're getting accurate demographics, you know that you're getting your insurance verification, getting a prior authorization if it's necessary, all of those little steps all equal better billing, right? So if you're doing each of those things appropriately, or if you're tweaking those processes to make it more efficient, then the higher likelihood is that you're going to have a claim submitted and a claim paid and faster.
Yeah, that's so fascinating. And in today's information economy, data is the new gold, or data is the oil, and that's what's powering everything. So if you can offer, like data and solution and services that solve a extremely complex problem such as insurance and billing, that's really so you do the data. Do you offer any staffing solutions or just help with staffing? Like if for example, if a physician office or practice, they need, your services, do you provide staffing solutions like a billing office or department, or if a hospital needs that?
Yeah, so we have a full service medical billing. So we can handle billing, coding, credentialing. We can do audits for practices. We can help with compliance. And one of the other things that we really work with practices is identifying trends that allow them to change their coding appropriately, of course, to help increase revenue, whether that's implementing the chronic care management services, or that's just using modifiers appropriately, or really diving in if they are having issues with denials, or if they previously had issues with denials, tracking and trending why they've had denials, and then correcting for those. And so really just depends on the practice. We also partner with a couple different software companies. So say a practice is looking for a EMR or a whole suite of e-prescribing and telemedicine, we can help suggest partners. Again, we personally do not offer that, but we're happy to pass on the savings that we get at cost for the companies that we have partnerships with.
Yeah, very interesting. We hope you don't mind this brief interruption from one of our affiliates.
Doc to Doc is a personal lending solution designed by doctors for doctors. We understand that doctors' financial situations change faster than an insulin drip in ketoacidosis. And we also understand that doctors are the most reliable borrowers in the world. Through our proprietary algorithm, we're able to provide personal loans at great rates with amazing flexibility, because we take into account your schooling, your specialty, and where you are in the medical journey. Doctors come to us after they've matched into residency, and we loan for all sorts of personal reasons, from credit card debt consolidation to family expenses and medical bills. We speak with everyone who applies for a loan, and offer fixed interest rates and flexible term options without prepayment penalties. If you're a physician looking for a personal loan, fill out our application form now. It only takes 3 minutes, and we'll get back to you with a decision within 24 hours.
So you have data, you have staffing, and how about in the consulting realm? Do you offer like if office or practice needs advice on how to increase the revenue, do you offer that as well?
Absolutely. And that can be as simple as trying to get a big picture view of what are the expenses and what are the revenue that's coming in and how can we tweak that. We can also spend some time looking at if you have revenue generated by providers that are, say, seeing the same patient base, but the coding is very different between the two providers. We can take a look and say, okay, why is this provider who's, presumably seeing the same type of patients coding more level 4s than another patient who's coding more level 3s? And so that really enables us to help practices hone in on what may be more efficient and appropriate. Again, it's always about making sure that it's clinically appropriate, but we oftentimes, when we start diving into the details on those trends, can really help a practice identify missed opportunities.
Yeah. And what sort of clients do you work with? Do you work with just small practices, or you work with like outpatient centers or large hospitals? Tell us more.
Yeah, so primarily we're working with outpatient practices and some physician groups that do inpatient services, but we're billing for their professional component. So we at this time are not billing for hospitals. It's mainly for private practices and physicians who say are, again, independent, but going in and seeing patients in the hospital. And so they're just needing to bill their professional piece. We have also worked with some audits for some surgery centers. And so that has been a good experience for us to kind of see on the facility side. But in general, it's private practices that we're primarily supporting.
Yeah. And so if I were a private practice owner, my revenue, I see it's declining. What's the number one mistake that you're seeing in these? Why are they? Is it wrong billing or just not adequate staff? Tell us more.
So the number one thing seems to be kind of stems back to that data, right? They're not tracking and trending the data. And so it's kind of like they don't know where things are going wrong. The denial rate could be high, but they don't know that the net denials are all coming because there's a lack of insurance verification. So patients come in, their insurances have changed, and they aren't aware of it because they don't have that checks and balances in, and then they're getting denials because of it. We also see practices that the staff just really isn't staying on top of the denials, right? So there's, obviously timely filing comes into play there. So the denial will happen. And then instead of getting right on it and managing that denial immediately, they're waiting 30 plus days to manage those denials. And every step of the way, if you have a delay, whether that's in a, rejection or a denial or anything that goes on through the claim process, then you bump up against timely filing, and the likelihood of not capturing that revenue increases. And so for us, one of the main things I tell practices who say maybe have an in-house biller or aren't quite ready to switch to a billing service like ourselves is to look at your accounts receivable. Look at your data around accounts receivable. What is your average AR in days? What is the percent of AR over 90 or 120 days? And that can give you just a real glimpse of how are things doing. Obviously, it's important, to track and trend that to see why you're seeing that, right? If you have a lot of money in your AR and you're not quite sure why, and then you realize, well, I have all these denials and that's why, then you can kind of dive into that. Another thing we've seen is about the patient payment process. And so if you're not capturing and collecting deductibles and copays ahead of time and trying to capture that on the back end, even though they may be small amounts, it just increases the likelihood that you're going to have, again, a longer AR, a lot of money held up where you're not getting paid. And so we work with practices to really improve that process so we can collect credit cards, save them in a HIPAA compliant manner, create a patient payment policy for the practice where the patients are coming in and they're signing that ahead of time so that they recognize the differences between copays and deductibles and why they're having to pay those and what the policy is for the practice if they haven't received payment when they're sending either an email or mailer out to the patient's home. And all of that, it just comes down to process, right? You kind of have to know each step of the process from the time the patient, comes into the practice to the time after the patient leaves and their bills are created and the insurance companies have paid or not paid, depending on the claim itself. So we really dive into the details on each one of those and make sure that the practices are doing it as efficient as possible and in a way that helps them capture that revenue as fast as possible.
Yeah, so it sounds like you have a very unique company, and what's really interesting is you talk about quality and efficiency and customization and innovation. So I think this has been a really fascinating conversation. I'm sure a lot of physicians are listening to this and thinking, oh, I want to increase my revenue. So how can they contact you, visit your website, and maybe possibly work with you?
Of course. So our website is nationalrevenueconsulting.com. And there's a contact us button on there. And then you can also email us at info@nationalrevenueconsulting.com. And we look forward to having a discovery call. We're also able to help sit down, even if you're not ready, if practice isn't ready to change billers, we're happy to sit down and take a look at the metrics that they have in their practice and help give some guiding tips to say, hey, you may want to look at this or drill down on that or think about this differently. And so that's been another, again, that's a no cost service that we're happy to do and sit down with practices. Should they be questioning, gosh, I don't even know where to start. I feel overwhelmed. How do I go about this? It just helps us give some ideas and tips to the practice who may be struggling.
Yeah, that's been so for all the listeners out there, Heather's links and resources will be included in the show notes. And Heather, is there anything you'd like to add before we conclude?
No, I appreciate the time today and hope you guys have a great afternoon.
Yeah, you've given us a really good overview and how national revenue consulting fits in, and I'm sure a lot of people will have generated a lot of interest.
Thank you.
What a fantastic show. I hope you enjoyed our very special guest. Just remember, as a shout out to our this week's sponsor, cityvest.com. Cityvest gives you access to the best real estate private equity funds with enhanced investment terms, verified due diligence, and lower risk. You can check them out at cityvest.com or click on the link in the show notes below to hear about their upcoming investment offerings. If you enjoyed that episode, don't forget, that's just the free content. We also have paid premium content subscription with better guests, information, updates, and discussions that can't be accessed anywhere else. You can subscribe to our premium content by clicking on the link in the show notes below to subscribe. Just a quick note, members who sign up for the bottom floor price introductory the first year will be grandfathered into that price for life. I expect the monthly subscription amount to increase quickly next year and the year after, so don't delay. I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislewmdphd.com for more support. I'll see you next week.